open up the presentation. Can you guys see this? Okay,
Yes.
some of this I talked about last time we met in December. So if you were part of that talk, then some of this might sound familiar. And then even still, we're going to talk a little bit more tomorrow about, specifically about telemedicine and online services. So some of the things that we talk about now, we'll do a deeper dive in tomorrow's talk. But we'll go through it, and depending on how much time at the end, we'll also maybe look at some of these online portals and maybe even look at myturn.ca.gov just to kind of familiarize you guys with the website. Okay. So just a little bit about me, as Mosen already said, I'm a family medicine doctor over at MLK Outpatient Center and faculty at CDU. I grew up in Riverside, California, and now you can be my real church family by knowing me as a child. Here I am with my big ears and all. Okay. This is me and my wife. The one on the picture on the left is when we first moved out here for my job here at CDU. And this one is from last year, actually. So, we found out that she had a rare blood disorder and she had to have a bone marrow transplant. And this is us in the hospital, a couple weeks after the transplant had happened. And I love that I keep getting to add to the story because this is in January. This was me getting my vaccine. And then the picture, I didn't get a picture of Felicia getting her vaccine, but this is the photo of us taking, to remember her getting her vaccine. So I got mine in January, she got hers just about 2 weeks ago. And everyone's always asking what vaccines you got. Here that Dr. Vargas got Johnson & Johnson, I got Pfizer, and my wife Felicia got Moderna. So, it's the full house in here. And I think I second what Dr. Vargas said in that really whatever you can get is going to save your life. It's going to save someone else's life. Okay. So the summary, I'll give you the summary and then we'll backtrack over each point. But the things that you guys as navigators, I want you to think about is if you or the person you're assisting doesn't already have a primary care provider, please help them facilitate and get one soon, because the primary care provider is the segue to get all of the other services that you need within the center. Utilize your clinic's remote, online and mail-in services, and those have increased exponentially over the past year. So there's a lot of services available. Utilizing home devices like blood pressure cuff, glucometer, or pulse oximeter as needed can be really effective in helping make sure that chronic conditions still get managed well in a time when you're not able to physically access the building as much. For when you do need to visit the clinic, try to group the visits up as much as you can so you can minimize the number of times you have to go to the hospital. You don't really, because majority of us are vaccinated, because we all wear masks and we practice safety precautions, we try our best to minimize the risk of a patient being at the hospital. Yet it is still a large, building with a lot of people in it. So you want to minimize the number of times that you're going to the clinic or to the hospital. And so if you can bunch your services together, then that might decrease your own individual risk. And then also want to make sure that you take a step back and ensure your own personal, physical, mental, and spiritual well-being. And then, like I said, at the end, if we have time, we're gonna go over to the myturn.ca.gov website, and we're gonna just kind of explore a little bit on how to sign up for the COVID vaccine. Okay. So a lot of people are talking about the state of the pandemic, and this chart here is a chart of encouragement now. Last time I talked to you guys was mid-December, and it was a chart of discouragement. I feel like we're beginning to hit a turning point here, but I think we also still need to stay diligent and also just realize, the narrative that's going on within LA County that Dr. Vargas pointed out. This map representing vaccination percentage, with South LA essentially being one of the lowest vaccinated areas in LA County. So still a lot of work to do. So going back to the benefits of having a primary care provider, it helps you avoid unnecessary trips to the clinic. They can prescribe medications over the phone in certain situations, and it's far greater and superior than receiving basic primary care needs from an ER or urgent care. Okay, ER and urgent care are designed for one thing, to make sure that if you are sick to the point that you need to go to the hospital, that they stabilize you and get you into a hospital bed. Okay. Otherwise, they want to make sure that you get out of the ER and get back home. Okay. But the primary care provider is there to make sure that all of your chronic needs are met, not just the one agenda item that you present that day. Okay. And like many of our providers now, I was just in a conference with a lot of family medicine residency educators, and one statistic really struck a chord with me, and it was that this time last year, about 10 to 15% of family practice doctors use telehealth services. And this time this year, it's at about 90%, right? So a lot of us, this is new to a lot of us. I mean, our MLK has been using phone appointments and phone services for quite a while now, so it's not necessarily new to our clinic. But telehealth services have become much more mainstream and much more robust over the last year. So we're going to talk a little bit about how to utilize that. Okay. So when you're preparing for a phone appointment, it's much like preparing for a regular primary care appointment. You want to make sure that you have all of your medications and take a note of them. And if you have less than 2 weeks supply, then you write that name down and make sure to ask for a refill. If you have any questions or concerns that you want to discuss with your provider, make sure you have those written down as well, and let them know at the beginning of the visit, there's a couple of things that I want to talk to you, doc. I want to talk about my back pain. I want to talk about my blood pressure. And I want to talk about my diabetes. So that way they know that you have things that you need to address, just as they might have things that they want to talk about as well. Okay. If you are diabetic, checking your sugar level routinely with the glucometer is a good idea, and it can help your doctor make better decisions about your medications, about titrating your medications over the phone. If you have high blood pressure, getting a blood pressure machine and checking your blood pressure once or twice a day and writing it down in a journal is also a good idea, because I in the time of phone appointments, I rely very heavily on the measurements and readings that my patients tell me from their home blood pressure machine to adjust their blood pressure medications. Okay. Using clinic remote resources. Most medical centers and labs have a web portal, which allows you to see lab results, notes, letters, emails, allows you to message your providers. It allows you to request refills. Okay. Ask your provider how to create a portal account. Usually all you need is your medical record number and an email address. For medications, you can ask your pharmacist if they have a home delivery service. And by this time, most pharmacies do. I know MLK does, CVS does, Walgreens, Walmart, Target, which is, again, CVS pharmacy, can all of those have mail-in service delivery services, and sometimes in Kaiser as well. Sometimes that actually the mail delivery of prescriptions might actually save you money as well. For example, with Kaiser's pharmacy, um, if you do the mail-in service and you get a 3-month supply of say your metformin, they will only charge you for the 2-month supply. So you save 1 month's worth of a copay. Okay. So what happens when you need to come to the clinic in person? And sometimes, this will happen where I'm talking to a patient and they're presenting a complex scenario that I can't decipher, just on the phone. And I say, hey, I got to see you in person to understand what's going on better. Make sure that you continue to practice the safety precautions. Wear a mask, preferably with at least 2 layers. And again, try to bunch as many services as possible. So if you're coming in to see the doctor, if there's lab work that's available, go ahead and get those labs done at that same time. If you're due for a mammogram, see if your doctor can order the mammogram same day for you. So that way you don't have to come a second time for your mammogram. Okay. If you need your prescription refills, try and get those while you're there. Try to bunch those appointments up so that way you can minimize the number of times you have to come to the clinic and risk being exposed. We do try to keep COVID-related services separate from not COVID-related services, but that doesn't mean that both people are still on the same campus in the same grounds. Okay. Yeah, just to talk a little bit about protecting your and your brothers and sisters' personal well-being. Preliminary and anecdotal data is suggesting an increase in referrals to mental health services for anxiety and depression over the past year. Okay. If a loved one is struggling, please contact your provider about your medical center's mental health department. Okay. Through the Department of Mental Health, County Department of Mental Health, there are urgent care clinics designed just to respond to mental health crises, whether it's suicidal ideation or psychotic breakout or a panic attack or depression. These are our Exodus mental health urgent cares. Okay. And we have one on the MLK campus. There's if you Google Exodus mental health urgent care, you'll find all the other sites throughout LA County. And so I've put the address here for Exodus on the MLK campus along with his phone number. They're open 7 days a week, usually 10 a.m. to 7 p.m. And you can walk in, or you can they have phone services as well. Okay, the LA County Department of Mental Health also has a general helpline, which I provide here, and I'll email these slides to Edward for future reference. In the case of someone reporting that there's that they've thought of hurting themselves, okay, the National Suicide Prevention Line and website are here as well. Okay, and for specifically a crisis line for those who are adolescents. We have the California Youth Crisis Line. Okay, I'm providing several resources here because I want to make sure that there's a lot of options and opportunities to for people to reach out. Okay. And as far as general well-being, talking to a group of church members, I feel reassured by your guys's integration and sense of community and togetherness, in that you are providing a service that the medical community cannot provide, which is maintaining a level of normalcy in this, you know, in this time of the pandemic, right? But in the absence of that, you know, just making sure that you know, reach out to your friends and family through phone calls and video chat and Zoom parties. Um, and I don't know if I'm talking to anyone whose church has opened up, but remote worship services are also still a viable option. Um, and you know, save protecting additional time for yourself during this, you know, this critical hour. You know, this has been a full year now that we've been dealing with the pandemic, and COVID fatigue is beginning to set um, in a very real and palpable way. I think that that is reflected in part of in what's happening in other states. It seems like, you know, kind of the powers that be in, for example, Texas, and have just kind of given up. And I wonder if part of that is just from a fatigue of holding on throughout this pandemic for so long, right? So making sure that you set some personal time for yourself to recharge through prayer, reading, reflecting, and coping and grieving for those of us who have lost people and loved ones over this time. Make sure you have set aside time for that. Okay. Um, Continue to maintain healthy choices and promote physical well-being. Okay, walking is still an excellent and safe form of exercise, especially if you know, you go outside, you put your mask on, and you go for a walk. Um, During the time of the pandemic, it is still very safe and very healthy option for exercise. Okay, for those who want to stay indoors or have limited mobility, whether that's because they have really bad arthritis or um, you know, bad hip pain. Okay, there's a lot of YouTube. If you pull up YouTube and you search chair aerobics, okay, there's a lot of home exercise plans where you're literally sitting in a chair doing exercise, but you're still getting the benefits of doing exercise. Okay. Um, for those who have uh, more pointed uh, musculoskeletal or muscle pains, um, talking to your physical therapy about remote sessions. Uh, I know our physical therapy department has begun to do video based sessions instead of in place of in-person physical therapy sessions. And try, you know, just a friendly reminder to try your best to stick to any diet restrictions recommended by your medical team. Okay. I know that this is a challenge. You know, this is particularly a challenge. And I know that I am guilty of ordering from Uber Eats a little bit more than I should be. Um, you know, but you know, just these little decisions do matter. You know, and if you just decide, okay, you know, today I'm going to try and eat more leafy green vegetables. Well, that's a start right there, you know. So, okay, when you're ready to get the COVID vaccine, so at DHS, you know, people are always asking me, and again, I agree with Dr. Young and Dr. Vargas. I reject the idea or the narrative that that the Black community is not vaccinated because they don't want to be. Okay, I reject that idea because my patients are asking for the vaccine all the time. Okay, and if you're eligible for DHS services, whether you're a patient at one of the county facilities or just eligible, you can get your vaccine at one of the DHS sites. So, you know, MLK, Harper, Rancho, just call the general primary care clinic line and say that you would like to get vaccinated, and then you'll get directed to the COVID vaccine clinic nurse. Okay. If you are not DHS Department of Health Services eligible, but you're still living in the county, then you can also use the state's website, which is myturn.ca.gov. Okay, which I think we might have a little bit of time to go over to. What's my time, Sharon?
You actually probably about maybe 3 to 5 more minutes, because we still want to save some time for questions and closing.
3 to 5 minutes. Okay, cool. Yeah, so we'll go over to the website just very quickly. For 3 to 5 minutes. Okay, so let me pull up the website here. Okay, so if you type in a web browser, myturn.ca.gov, do you guys see that?
Yes, we see it.
Okay. This is the page that you go to. And the first series of questions are just to determine if you're eligible. So I'm going to hypothetically say I'm a 64-year-old male with diabetes, and I'm going to go through the registration just to see how far we go. I'm going to go up to the point of signing up for the vaccine because I have already got it. So I'm going to leave the appointments open, right? These are some acknowledgments that you're over 18, that you're okay with getting the vaccine. Okay. And some general policies for using the website. Okay, so here you would pick your age range, and me being a 65-year-old male, I'm going to click 65. Okay. Do you currently have any of the following conditions that put you at risk for extreme complications? And this is some of the tricky parts, right? So it's asking for example, type 2 diabetes with a hemoglobin A1C greater than 7.5. Okay. If you know that, and if you have access to your online portal, you might be able to pull that up and say yes. Okay. Which would make you eligible even if you're not 65. Do you currently have a physical or mental disability that is so severe and high risk that one of the following applies? That COVID-19 is likely result in severe life-threatening illness or death, or 2, acquiring COVID-19 will limit your ability to receive ongoing care or services vital to your well-being and survival. Okay. In this case, I'll say no, but I've already fulfilled eligibility based on age and medical conditions, so it doesn't matter. I'll put other here. This is just asking for industry, line of work, what county, LA County, and then I'm going to put, this is the zip code for CDU and MLK right here. Oh, I missed something. Let me see.
I think it's the access. The access. It's not the zip code. Cool.
Oh, access code.
Yeah.
Sorry, it asked for the zip code. I was jumping the gun here. It asked for the zip code on the next page. Okay. All right, so you'll see that Ketron is actually the main vaccination site in South LA. And Ketron is doing about 2,000 to 2,500 vaccinations a day. And so if we click at our fellow comrade, Jerry Abraham, is burning the midnight oil over there, doing 2,000 shots a day. And so you can schedule an appointment. It pulls up a calendar and you can pick one. Okay, so let's say I pick 9:50, and then it goes here, but I'm gonna stop here because I don't want to lock in the appointment and I don't want to block someone out of this. But that is the walkthrough for myturn.ca.gov. And in the case that someone is not going to be here, or someone is going to be here tomorrow that wasn't, we'll probably go over this again tomorrow during the telehealth and portal services talk. Let's see. Let me go back to my slides. We're just about done here. And we'll go to the questions as Sharon had requested. So yeah, it's just my summary page. So again, the first thing is to make sure that that you or whoever you're helping has a primary care provider, that you utilize and lean into the remote online and mail-in services that your clinic has available. Try to bunch physical visits together to minimize your own risk to getting infected at the clinic, and ensure that you take steps to protect your personal, mental, physical, and spiritual well-being. And when is your time? Sign up for the COVID vaccination. Okay. Thank you guys again. Really appreciate it. I know it's like 8:30 tonight, so you guys are real champions for staying through here for, I think, 4 hours.